So just to introduce myself, my name is Kelly Henry. I'm a physician at Loyola University Medical Center in Maywood, Illinois. I am an associate professor of internal medicine and pediatrics at Loyola. I'm also a part of the Gun Violence Prevention Committee for Doctors for America. I'm also a member of Moms Demand Action and the Be Smart campaign, which is about keeping kids safe from guns, specifically talking about secure storage of firearms. And so that's what I'm going to be focusing my talk on today is Safe Storage of Firearms 101. So some of my objectives of this talk is what is secure storage and why is it important? And what are discuss physician firearm counseling? What are some of the barriers to counseling? Who should we be counseling and does it work? So first I want to start by just really quickly reviewing gun violence in kids. I know a lot of you guys have already received some of this information earlier from other talks, but it's the second leading cause of death for children in the United States. And it's the leading cause of death for Black children in the United States. We know that car accidents are number one, but as we saw, cars are becoming safer. And unfortunately, we're seeing increasing gun violence trends. 1,600 children are killed by guns every year. This was actually a slide that I had before that I just recently had to update because that number increased. 53% are homicides, 40% are suicides, and 7% are unintentionally killed. Like others have talked about the role of firearms in suicides, we know that 2/3 of gun deaths are suicides. And so we really need to focus on this number as well. As you can see from the graph, after unintentional injury in children, 10 to 18 and young adults up to the age of 35, it's the second leading cause of death in the United States. And it is the fourth leading cause of death for 35 to 55-year-olds in this country as well. In 2018, 24,000 people died by gun suicide, and about half of child suicides are with a gun. How long do we think someone contemplates suicide? It's very short. Unfortunately, it's only about 10 to 20 minutes. It's a very impulsive decision. And a survey that was sent to adolescents who had attempted suicide, the average was actually 5 minutes, where they made a very impulsive decision. And we know that when a gun is used, that impulsive decision becomes a lethal one. Death by suicide is 5 times more likely in a home with a firearm present. So we've talked about this. We've seen over the COVID pandemic an surge in gun sales across this country. We know there was an 80% increase in just the first 4 months of the pandemic. We know that the schools were closed during the pandemic, and that more kids were socially isolated, more time was spent at home, there was more stressors in the home environment. And while the adults were trying to, do work at home, the kids were home. And so this whole situation, what we were concerned was gonna lead to a dangerous situation. And unfortunately, this article was recently published in the Journal of Pediatrics in April of this past April, and we have seen an increasing firearm injuries during the COVID pandemic, and you can see from that graph. And these incidences were correlated with new firearm ownership. As we've already talked about, greater than 2.5 million people became first-time gun owners during the pandemic. And these were new gun owners who were buying guns for protection. They were often handguns, and we know that these are less likely to be stored locked and unloaded. And when it comes to COVID and suicide, we know we're seeing increasing unemployment, financial stress, social isolation, there's increased anxiety and depression. And again, this article looked at specific gun purchasers during the pandemic, and they found that they're more frequent reporting lifetime, past year, and past month suicidal ideations than non-gun owners and also gun owners who did not purchase a gun during the pandemic. So like Sandy talked about and Julie talked about, we're seeing a different type of gun owner since the COVID pandemic has started. When it comes to pediatric suicidal ideations and attempts, I thought this article was very interesting as well, and this was also recently published in the Journal of Pediatrics, and it looked at trends from 2019 to 2020, and unfortunately, again, we're seeing increasing pediatric suicidal and attempts in our pediatric ERs. And I can say firsthand as a pediatric hospitalist, I've seen increased amount of children who are being admitted for mental stress. and increasing overdose and intentional overdoses in children. And so, you know, I think this is a very sad situation. So what do we know? We know that regardless of if a child lives in the home, 1/3 of households contain at least one firearm. We know that 5.2 million children live in a home with at least one loaded and unlocked gun. And we know for children under 13, most gun homicides occur in their home. Greater than 90% of unintentional shooting deaths occur in the home of the victim. And we know that a 2 or 3-year-old has the tensile strength to pull the trigger of a handgun. When it comes to school shootings, we know that 80% of school shooters obtained the gun from their home or the home of one of their relatives. So what do we mean when we talk about safe storage? How many of you, when you were little, you maybe went searching for birthday presents or holiday presents, and how many of you probably found them? And now maybe you hide presents from your children, maybe high up in a closet or under a bed. You know, guns really aren't any different. 13 million children live in a household with at least one gun, and studies show that the majority of children know where these guns are located. 1/3 of children have admitted handling their parents' gun without their parents even knowing. So what do we mean when we talk about safe storage? We mean storing a gun locked and unloaded with the ammunition stored separately. And we know that hiding a gun is not securing a gun. Children are very curious and they will find them. We know that guns, responsible storage is associated with the decreased risk of firearm suicide and unintentional firearm injury in children. And this was a really important article that was published in JAMA 2005 that looked a little bit more at this. So this is gun storage practices and the risk of youth suicide and unintentional firearm injuries. And the purpose of the study was to measure the association between storage practices and the risk of unintentional and self-inflicted injury in children and adolescents. And they looked at 106 shooting incidences that occurred over 37 counties in Washington, Oregon, and Missouri. And any child or adolescent that was less than 20 was included in this study. Assaults and homicides were not included. They found 106 shooting incidences, 82 were suicide attempts, and 24 were unintentional injuries. It was a case control design, so the controls were used by telephone surveys in the area where the case guns were located, and they were included if they owned a gun and had at least one child living in the home that was under 20. And what they found was case guns were less likely to be stored unloaded, less likely to be locked, and less likely to be stored separate from ammunition. Keeping a gun locked and unloaded with ammunition separately were all associated with a significant decreased risk of suicide and unintentional injury. Using that previous study, this study that was published in the JAMA Pediatrics in 2019, did a modeling study using the information from the previous study, and they did a hypothetical intervention where they had 20% of households change their practice into storing firearms more securely. And what they found was with that 6 to 32% of child deaths could be preventable. So we know that there's a large body of evidence that says safe storage significantly decreases unintentional injury and death, but what are parents' perception on safe storage of firearms? What do they think? And this was an article that looked at 8 focus groups in Arkansas, Alabama, and Tennessee. And the overall perception for parents for gun risk for their children was very low. A lot of them felt that guns were needed for emergencies and they should be kept loaded and easily accessible, even if their child may need it. So they said maybe they went away from the weekend and they may hide medications and alcohol, but they didn't do anything with their firearms. Others felt that they recognized the competing risk of safety, that their child may hurt themselves with a gun, but that it was a difficult decision for them because they felt that they needed the gun for household protection. They did express an openness and willingness for education, and they were willing to store their gun more safely if an easy to access biometric safes were more available. This article was published in the Pediatrics in 2018, and it was a national survey that was sent to parents to look at safe storage practices and for parents that have self-reported children with harm risk factors. And the parents self-reported if their child had a history of self-harm risk, and they found that it did not affect their decision either to have a firearm in the home or how it was stored. There was a separate adolescent survey that was sent that asked adolescents similar questions, and adolescents, 40% reported easy access to a firearm in their home. The presence of mental health and suicide were similar for those that had access and those that did not have access. But those that had access were more likely to endorse that history of alcohol and drug use. We know that drug and alcohol put people at greater risk for suicide with firearm access. So this is a very important topic because, again, parents may not know that their childs are reporting easy access to firearms. And this is our opportunity to counsel and risk identify where these patients may be, and making sure that this conversation is had with these families. When it comes to military, there was a recently published article in just in this past July that looked at a classroom survey that was sent to 1,000 service members at a large training center. And they found that among firearm ownership, those with current depressive symptoms and perceived likelihood of future suicide attempt were both significantly associated with unsafe storage practices. We know this presents a very dangerous situation, as service members in general are hesitant to seek help about their distress. So again, our job is to change and promote a shift in cultural norms about safe storage practices as a suicide prevention tool. How many of you guys have ever thought about asking your dementia patients and their families about firearms? There are 50 million people in the world living with Alzheimer's or other related dementias. And this number is projected to triple by 2050. In older adults, 91% of gun deaths are suicides. And we know that especially in early stages of dementia, there may be an increased risk of suicide. And having a firearm increases that risk, especially if it's loaded. We also worry about the potential risks to others in the home. There's an estimated 20% of home-based dementia caregivers experience aggression or violence. And again, this can be extremely dangerous when there is a gun in the home. We know that 40 to 60% of households with patients with dementia have a firearm, and it's equally prevalent regardless of dementia severity. In one study that asked dementia clinic patients, the majority of families either reported that their gun was loaded or they didn't know the status of the gun in their gun storage in the home. We know that it's a powerful symbol of personal identity and independence for these patients. They may have been gun owners their whole life. And so this is a very delicate conversation, but one that needs to be had. Caregivers have identified that they would like to have these conversations with their physicians, that they're overwhelmed at times, and they may not have even thought about this conversation or have thought about the guns in their home. So this is, again, our opportunity to bring up this issue with them early on and have a proactive approach on discussing options for storage, transferring, or removing the gun, as this will all help prevent harm. Physicians, we know this is a health crisis. All of these major medical organizations have come together that we need to have a call to action on what we can do to prevent gun violence in this country. Yet, despite all of these organizations having a stance on discussing gun safety with our patients, we're still not doing it. So why are we not talking about guns? Almost all pediatric residents stated we should be talking about gun safety with our patients, but 2/3 said that they never counsel or counsel less than 5% of their patients. 2/3 of adult PCPs stated they never ask about guns in the home. In veterans with suicidal thoughts, 15% of providers documented access to firearms. In another survey, 80% of surveyed caregivers in homes with firearms thought providers should discuss firearm safety and dementia, but only 5% had reported receiving such counseling. So despite all this, why aren't we talking about it? What are our barriers to counseling patients? Time is a big one. Time is a barrier to a lot of things in medicine. We know busy clinics, we're running around. We have a lot to talk about with patients, that this may be a topic we've decided is not as important, and we just don't have time to talk about it. We may not have confidence in our ability to counsel. Maybe we don't know a lot about guns. We don't know about devices. And so we decide, you know what, we'll talk about, we're not comfortable with this topic, so we're going to avoid talking about it. We may be afraid of affecting our relationship with the patient or family. We might be afraid of legal implications, or we're just not certain of what the effect is going to be. So we just decide that maybe it's a topic we're not going to talk about. So just to kind of break down some of those barriers a little bit further in the next coming slides, is it legal for physicians to discuss gun safety? Yes. There's no federal or state that prohibits physicians from asking about firearms when the information is relevant to the health of the patient or others. You may have heard that Florida had enacted a gag law in 2011 attempting to prevent providers from discussing firearms with their patients, but this was struck down by the U.S. Court of Appeals, and there is no law against discussing firearm safety with our patients. For small children, again, we should be framing it as a safety issue. It shouldn't take that long. It doesn't take long to discuss car seats or bike helmets, pool safety. Child access to guns should also be included in our well child visits when we're discussing safety anticipatory guidance in clinic. This is just an idea that of different ages that we should be counseling families on gun safety and gun education. You know, birth may seem like a very odd time, but I do think that this is a great time. You know, parents are very receptive to all the information you can provide them. Even as a pediatrician myself, when I came home from taking my twins home from the hospital, I read every single piece of material that was given to me because I just wanted to make sure I was doing everything I could to take really good care of my kids. And I think this is an opportunity for us to include information on gun safety at discharge from the hospital. You know, these parents may have been gun owners their whole life, and it may not have even been something they've thought about. So this is time to build awareness on this topic. Toddler preschool, we know that this is a time kids are getting more curious, in addition to talking about medications and cleaning supplies and all of that, those topics. When we talk about childproofing, we should also be talking about firearms. School age children, we know they're less supervised. They may be going on play dates. They're curious. So just educating our families that even if it's, you know, they don't own a gun, their child may go to a home with their gun. And so with a gun, so it may not be their gun, but it might be their child. And this could be any child that goes on a play dates or even to other family members' homes, grandparents, you know, cousins, houses, to make sure that there's no guns in those homes as well. In adolescents, again, we know they're very impulsive. They're often unsupervised. I think any adolescent that has a positive, you know, screening for anxiety and depression, this is a time that we should be counseling families on keeping their adolescents safe at home. For adults, I don't think we need to be blanketly counseling all of our adult patients because, again, there's more time constraints perhaps on the medicine side. But it's important that we're counseling those that are obviously acute risk for violence to themselves or others. This is an emergency and we need to act promptly to ensure safe storage. And those individuals who have risk factors for violence, so a history of violence, alcohol or drug abuse. We know alcohol abuse is common among firearm owners, and it's a well-established risk factor for interpersonal and self-directed firearm violence. And then members of certain demographic groups you may consider counseling as well. So middle-aged or older white men are higher risk for suicide. Young African-American men are higher risk for homicide. And we know that children and adolescents are a group of minors we should also be counseling. So now that we know all this background information, you know, is counseling effective? Does it work? And there are many small studies that looked into this further, and I just wanted to highlight a few of them just to, you know, for you guys to see. So this was a study that was published in the Journal of Pediatrics in 2008. It was a cluster randomized controlled trial from 2002 to 2006. And they looked at 124 different pediatric office practices, and they sent surveys to parents that were presenting for well child checks for children that were 2 to 11. These parents completed a pre-visit survey and that asked them multiple questions, some about media use and violence, video games, and then also about their gun ownership and how it was stored. And then they divided it into 2 groups. There was a control group and an intervention group that received brief motivational interviewing, and then they could go home with a cable lock to more securely store their firearms. And then they did telephone interviews at follow-up for 1 month and 6 months, and they found that for every 2.5 patients that they counseled, 1 family reported use of a cable lock. That was a 21.4% increase in storing a firearm locked at the end of this study. Another study that I thought was interesting and a little different was counseling on youth seeking emergency care for suicidality. This was a study that looked at a children's hospital in Colorado that had around-the-clock providers for behavioral health crises in an ER setting. And families of 12 to 17-year-olds were included in this study. And it involved a 5-minute counseling session on locking up medications and guns. And then they did follow-up phone interviews afterwards to see, their results. And what they found was at the time of ER visit, about 67% of families said that they did store their guns locked. But at the time of the follow-up phone call after the counseling session, 100% of families had stated that they now had kept their guns stored locked. And I think, again, this is a very important study, I think, because it just shows when the context is entirely about safety, people want to make change. These families were in a very vulnerable situation where their child maybe did something that really surprised them. They weren't expecting this impulsive behavior. And this is our chance to use this opportunity to educate on the importance of making sure guns are stored safely and building awareness on this conversation. And then lastly, this was a systematic review of all the randomized control studies of safe firearm storage interventions. And the authors found that in the studies in which the free devices were provided with the counseling sessions, those were the most effective at improving safe firearm storage practices. So if you're gonna do counseling in your office, having the ability to provide some type of firearm storage device is also extremely important to make change.